Hello everyone. In this presentation we're going to go about how to write an orthopedic case report. This is the lowest form of evidence in the literature and surrounds around one case that you present that you might think there is interesting or informative concepts to share with the readership. Normally, what is a case report? A case report is a detailed description of a single patient or a small series. It highlights rare, novel, or educational findings and focuses on clinical reasoning rather than statistics. Here we have an example of an excellent case report written by Garcia Ray et al. On total hip arthroplasty in a patient with severe osteoporosis. This was published in 2010 in the Journal of Arthroplasty, and it's an excellent case report because it addresses a rare condition with high surgical risks. It clearly articulates why standard approaches fail. It offers transferable technical lessons and is tightly argued and not descriptive. So this is a great example to follow if you're thinking about writing a case report. In general, case reports are especially important when large trials aren't feasible. Many major orthopedic complications, implant failures, or rare injuries were first recognized through case reports. They also train you to think critically and communicate clearly, skills that you will use throughout your career. Most cases are not worth writing, so you always have to ask yourself, is this truly unusual or just unfamiliar to me? A common mistake is that to write a case report because it was interesting or difficult. Difficulty alone is not enough. There must be a lesson for others in this process. So, an unusual presentation of a common condition, unexpected complication or outcome, a novel diagnostic or treatment insight, and a clear educational value. Think of these when you think about writing a case report. So, example of a strong orthopedic case report. Some of the examples are total hip arthroplasty in severe osteoporosis. This is a rare pathology with extreme technical risk. It has standard surgical assumptions that do not apply, and there's a clear educational value for all arthroplasty surgeons. This case was not published because it was rare alone. It was published because it forced the surgeon to rethink technique, instrumentation, and risk management. These are the kind of things that you want to make sure you have in your mind as you think about writing a case report. This is the most important slide in the talk. If you cannot answer this question clearly in one sentence, you should not write this case yet. Editors and reviewers are asking this exact question when they read your submission. What does this case teach that others do not already know? Why should a busy surgeon read this article? Commit these to memory and think about them as you think about writing a case report. Your core message that a case report is an argument, not a curiosity. So keep that in mind. What does this case teach? Standard broaching and reaming can cause a catastrophic fracture. Cementing strategy must be modified. Why should surgeons care? Osteoporosis may be undiagnosed pre-op. Lessons apply to other sclerotic bone conditions as well. So going back to this excellent paper in Journal of Arthroplasty, these are the kind of questions that you want to keep in mind. The structure is simple, but every section must support the same central teaching point. If the introduction argues one thing and the discussion argues another, this paper will fail, even if the case is rare. So you want to have your title and abstract. You want to have an introduction as to why the case matters. You want to describe the case, discuss and put this in the framework of literature, and have your concluding remarks. So the introduction should be short and sharp. You're not reviewing the entire field. You're identifying a gap or a blind spot, and you're explaining why this case fills it. Usually 1 to 3 paragraphs is enough. The introduction frames the problem, not the patient. So a strong introduction is what they did right, briefly define osteopetrosis, explain why THA is uniquely dangerous, identify the gap, lack of practical surgical guidance, and state explicitly what the case will contribute. Writing the case description. This section should read like a timeline. Stick to facts. Avoid conclusions, opinions, or speculation. Those belong in the discussion. Clear figures and imaging often matter more than a long test. So a picture says 1,000 words, and it certainly holds true here if you have a few good pictures from the case. So you want to be chronological and factual. You include imaging, labs, and any intraoperative details, and avoid any kind of interpretation. So you want to be focused and you want to be disciplined. You must resist the urge to explain. Let the facts build the tension for the discussion. So again, chronological presentation, imaging, operative details, no speculation or interpretation. Now comes the fun part, writing the discussion. This is where most case reports succeed or fail. You must compare your case to what is already known and explain precisely how it differs. A good discussion ends with a practical lesson. What should surgeons do differently next time? So compare your work with existing literature, explain what is different or novel, discuss the lesson learned and the limitations. And actually, in discussion, this is where the paper becomes worth publishing, because you compared your approach to limited prior research, explained why certain tools failed or succeeded, you extracted principles that are applicable beyond this osteopetrosis case, for instance, in this paper, and you acknowledged the limitations honestly. Think of a case report as a courtroom argument. You are persuading the reader that this case deserves attention. Every sentence should serve that goal. If a sentence does not support that goal, delete it. You're not writing a story. Make sure you provide support for why this case matters at every instance. Be clear and avoid jargon and avoid complexity. Simple writing is often the most effective mode of writing and communication. Consent is non-negotiable. So this is very important. Even anonymized images can be identifying. Many journals will reject otherwise strong case reports for ethical deficiencies alone. You always want to make sure you obtain written consent early from the patient. Remove any identifying information and follow the journal's ethical guidelines for your publication. Choose journals that regularly publish case reports. Submitting to the wrong journal wastes time and affects your morale, because nobody wants to get rejected time and again simply because they did not make the right choice. Always read the recent case reports from the target journals before submitting to see what is the flavor of the types of works that they publish. So some of the places are Journal of Orthopedic Case Reports, BMJ Case Reports, Case Reports in Orthopedics. These are some sample places where you can submit your work. And some of the key references here that we talked about, these references are worth reading in full, especially the care guidelines. They provide a checklist that many journals explicitly require following a piece, and also this using these will help improve your acceptance rate. So the Garcia Ray paper, the Risen paper, and the Neeson and Wynn paper, these are all good papers that you should read in full and understand, and most importantly, read the care guidelines to ensure you can design your own case report paper well. Now, why this case report works? Because it addresses a clear clinical problem. It's logically organized and structured. There's a strong teaching message and lessons that are transferable to other conditions, and it's respecting the reader's time. More is not always better. Be brief, be succinct, be informative. So, the take home message for this is think clearly, identify the teaching point, build a strong and honest argument, and make sure that, every setting can produce publishable cases. A good case report answers a question the reader did not know they needed to ask. Keep that in mind, and thank you for listening.